Everyone. Hi everyone. Dr. Ashley DeBoer here with Dr. Krystyna Holland. She is our brand new pelvic floor PT that will be seeing clients out of our office immediately. So we wanted to just come live with you guys today and chat a little bit about what she does and why you may want to see her. Because I know I'd say I've been in practice just a little bit longer than Krystyna. She's a little bit younger than me, just a little bit younger than me. But I'd say probably maybe like the last 5 years, there's just been this surgence of online presence of pelvic floor PTs, right? And so I know a lot of my new mommies and pregnant, not just new mommies, but pregnant mommies and ladies in general are hearing of all the great things that pelvic floor PTs can do, but maybe a little bit unsure of what exactly it is, right? So I'm gonna have Dr. Krystyna take just a few seconds, introduce herself, tell us a little bit about yourself. Sure. And everything like that, okay?
Yeah. So I'm Dr. Krystyna Holland, and I am a pelvic floor physical therapist. A lot of people don't really know, so more and more people are finding out what it is, but a lot of people don't know exactly what I do.
Right.
I'm actually from Virginia, but moved to Colorado in July, and I'm absolutely loving it. Super excited to be in this office.
Right.
And
Colorado's fun. No, I don't want everybody to move here, but a few people.
Yeah. So the thing about the pelvic floor that a lot of people don't know is that it's made up of a bunch of muscles. It's basically a bowl of muscles. So
right.
Anything that can happen in your bicep or can happen in your upper trap can also happen in your pelvic floor.
Right.
So a lot of people think of physical therapy as someplace that I go when I get injured, but it can also help with people who are leaking when they laugh, jump, cough, or sneeze, people
right.
who are having pain with sex, people who are not feeling like they have a strong core, especially like for pregnant and postpartum mamas.
Yeah.
And people who are nervous about diastasis recti or pelvic organ prolapse. So those are all things that I see very specifically, have specialized knowledge in, that maybe if you just go to a regular physical therapist, they might not check for or know about.
Right, right. And so especially with what we see so much here at Rise is our moms that are pregnant or postpartum. I think what a lot of times happens is, as much as I do see in the more Western medical community, pregnancy becoming kind of like this almost like disease, you know, like you got to be careful and stuff like that, a little bit of that. But we also have that it's not everyone will say it's natural, but it's like your OB will go in at like your 6-week appointment. You're ready to go. You're good, girl. You're healed or whatnot.
Yeah.
But what people don't realize is when you're pushing that baby out, that is trauma to those muscles, right. You know, so like you were saying, oh, you have trauma to like your bicep, you lift too heavy or whatnot. I'm like, you're pushing out an 8-pound kid and everything's got to spread and open and it's supposed to be a proper, and it's just, nothing's going to happen to those muscles, you know? So I think it's really interesting to see, you know, just talking more about like this pelvic floor. And by the way, women aren't the only ones with pelvic floor, okay?
Yes. And everyone has a pelvis. Everyone of every age has a pelvis.
So guys are like, well, I don't need to see a pelvic floor therapist. You're like, you have a pelvic floor too. You just don't have a uterus. Okay.
Correct.
And pushing babies out that uterus.
Yeah.
Okay.
But men can also leak, not postpartum, probably,
right.
But they can leak, and that can also often be tracked back to pelvic floor dysfunction too.
Right, exactly. So maybe educate everybody a little bit of like, you don't have to walk them through completely, but what a first visit might look like with you.
Sure. So when people come in to see me, we do a lot of just getting to know like what your goals are, kind of where were you at before, what are you trying to get back to, or maybe it's something that you're not trying to get back to, but something you're trying to do better that you've never done before. I have seen clients who have never been able to have pain-free intercourse, and so I love working with those clients, like getting them to be able to have sex with their partners for the first time pain-free.
Right.
And so come in, a lot of like meeting me and figuring out what I'm about. I like to look at and see how people move like generally. So some people will look at just the pelvis, and like, because there aren't a lot of physical therapists who see pelvic floor, they kind of hone in on just like this section of the body.
Right.
And I'm someone who I look at kind of at the whole body and not just how you move, but what you want to do with it. What is your delivery history? Have you ever been pregnant? How many babies have you had? What was your birth story like? Because that gives me a lot of information about what you might need going forward.
Right. What was your physical activity prior to what you like to do for fun?
Right.
ride horses.
Yeah.
You know, right?
Bicycle.
You like
I
to
feel-
lift really heavy.
Yeah.
And we talk a lot about that with birth fit and stuff like that, and just like how that straining can do stuff and everything.
Yeah.
Yeah.
Sure.
So it's definitely intimate history.
Yes.
Right?
Yeah.
Okay.
Pretty in depth.
Yeah.
For sure. No pun intended.
Yeah.
And
totally. Just saying. Yeah.
And so that's normally the first visit, is just like a completely external, like, no, you'll wear all of your clothes the whole time, like just really talking about history, what you're hoping to get back to, what your concerns are,
right.
what you want, and what you think will work for you in terms of like a medical plan. Because I have been a patient. I had my own, so part of what got me into pelvic health was that
I was gonna ask that.
Yeah, so I had my own surgery in 2015. I had this weird collection of urinary tract infection type symptoms.
Okay.
And it turned out like I never actually had an infection. I was having some pelvic floor stuff, and I had a cyst, and I had a urethral reticulum, and all this like medical stuff.
Right.
That ended up in me having these symptoms, and I needed a surgery, had the surgery, and then post-surgery I was having leaking and pain with sex, and I kind of had even more symptoms post-surgery than I had before.
Yeah, you're like, what the heck?
Like, yeah, like this was supposed to fix me, and now I feel
Right.
worse than I did kind of before the surgery. And so that taught me a lot about what it's like to be in the Western medical system, and like not feel like you have a lot of choices when it comes to your medical care, and like a lot of input. Right. Into what decisions are being made about your body and your care.
Right.
And so a lot of that first visit is talking about that. It's like, what are you really looking for? And like, how can I support you in whatever your goals are? Not my goals, but like what you want to do.
Right. So was that kind of your first, not introduction, obviously, but like first kind of like you started to really look at like pelvic floor and what that intimate play with like leakage and stuff and pain and stuff in that area? Is that what kind of got you into it, or you had already been kind of dabbling?
I was kind of dabbling. So like the first like 10 years before I went to PT school, I was positive I was going to work in pediatrics. I was like, for sure I'm going to work with kiddos.
Right.
I was not in PT school very long, and I ended up at this conference where someone had mentioned pelvic floor physical therapy. I knew nothing about it. It's still like not commonly taught in like school curriculum.
Yeah, it's like additional.
Yeah, additional and like specialized stuff like that.
Mm-hmm.
And so when I learned about it, I had a history of working in like sexual health outreach, peer education programs, and I actually wrote a column about healthy sex and relationships for a while. And so it just kind of tapped into my knowledge and like my passion for that. And I really came to pelvic floor physical therapy in terms of like empowering people in a way, in like a taboo way.
Yeah.
Because once I realized that talking about things that make other people really uncomfortable doesn't make me uncomfortable, I decided,
you're like, oh, this is for me. Right?
Yeah. I was like, oh, it's my secret superpower.
Well, and I mean, it is really sad. I guess I'm blessed in what I do that most of my mommies feel comfortable bringing up stuff like that, you know, but it is really like, you know, there's just so many things in general, not just with sex, that should not involve pain, like pregnancy, like, you know, we've been told so much that like, oh, sciatica's normal towards the end. You got this big belly. And I'm like, no pain during pregnancy, no pain during sex is normal. Right. You know, so it's like just talking about that and peeling away with your patients and stuff. So it's nice that you're very, very comfortable talking about that, but and stuff like that. Right. But anyway, so back to the first visit. Yeah. So talk and stuff like that. Maybe probably most people are most leery about maybe the examination or whatnot. So what does that kind of involve?
Sure. So I normally would do an internal exam on the next visit if that's something that you even like a patient would even want. Like
or that you think
always
it's needed.
If it's needed, if I believe that it's needed, and then if it's something that the patient is looking for, if someone wants a more in-depth assessment of like what is actually happening in the muscles of the pelvic floor. Right. There's a lot of stuff I can find externally, and there are definitely I can get more information if I'm able to go internally. Right. But it is always up to the client, 100%. Your body, your rules. All the time.
Absolutely.
And so what that normally looks like, if that's something people are interested in, is I have a treatment table, and I am able to go internally, vaginally, with one finger, and just kind of assess what the muscles look like, and how they feel, like what the tone is, the same way that you can get like tight hamstrings. You
gotta feel them.
Yeah.
You know. So I know some people might be super uncomfortable, probably post-birth, less uncomfortable, unless something happened during birth, right? That give them some trauma. But honestly, you guys, like the best way for her to assess, I as a chiropractor, I can't, you know, so I do so much work with the pelvic floor and breathing and stuff, but there's just stuff that I can't work internally. So she'd be able to really, like you said, get a full picture. I really, really think it's important if you had any kind of stitching, any kind of stitching down there to work on scar tissue and stuff like that. So, I mean, the only way they're going to get in there to really get a good assessment is to do an internal exam. Right. But obviously, she'll go at your pace, and it's comfortable, and it's not forced on you. So if you don't want to, that's totally
fine. Right. And I've seen people that at first they were like, I don't want to go there. I'm not there yet. And that's totally fine. And we do stuff external, and I'm like, okay, this is what I think the information that I could get internally. Do you think that is something that you want to know about? And then over time and with more comfort and more education, like sometimes people are like, yeah, okay, I'm ready now.
Yeah, right. I mean,
it's fine either way.
It's an intimate exam, right? So it's just as much as maybe, your whoever does your pap smears and stuff like that, having, I don't know, I just never feel like that with an OB or midwife, like you can find that, but just to get to know you a little bit. So I could totally see that would be.
And my exam is different. So that's the other thing that people ask a lot. They're like, well, I got my 6-week checkup, for my OB, but we're looking at different things. So even if you had, or especially maybe if you had stitches, people will go in, your OB will go and look, and just to make sure that the wound is healed and that things look
the
fine.
Stitches have dissolved or whatever, right?
Right.
Yeah.
But they're not really looking at the muscular tone. They're not really looking at how those muscles are responding. If you think of pregnancy, like you're trying to hit a moving target, right? You're changing so quickly over the course of 9 or 10 months, really. Yeah. And then you're just supposed to deliver this baby in like 6 weeks later, kind of like what you were saying before, you just go back to normal. Yeah. But your 100%. System is totally different.
Right. 100%. You've gained weight that you haven't lost yet. Your pelvis and everything else is still loosey-goosey. Yeah. Muscles are tight. There are muscles that you didn't know you had. That's so funny, you know, and everything like that. So, I think it's super important. I honestly, I think everybody should have an exam to see what their pelvic floor is doing, regardless of where you are at. If you've had babies, you're going to have babies, you're postpartum. But I think it's I love when my mommies get to a pelvic floor PT when they're pregnant. Usually that's the first time maybe they've kind of understood, unless like you had something that went on younger in life, that they're like, maybe I should check. But just to get that assessment, is just a really great thing. There's so many times that you're told too when you're in birth, and this is something we can dive into later on another topic, but what I find a lot of mommies that, they get this failure to progress where they're dilating unevenly or whatnot. And sometimes the OB or midwife will go in there and massage to help dilation more evenly. And sometimes it doesn't happen. And I go, oh, if only, not all cases, right? But probably a good vast majority had you just had some release work or whatever it is, or training that this is not, you need to strengthen this or whatnot, that maybe that would have happened, you know, and you wouldn't have had that failure, and you wouldn't have had to have some induction medicine or a C-section, and we forget, I think a lot, moms that have had a C-section know that it's major surgery, right? It's kind of become commonplace that it's not that big a deal, but cutting through that abdominal wall, it's like,
and for sure you need PT after that, right?
100%.
Like if you had an ACL tear, they wouldn't just tell you like, okay, 6 weeks, go run your marathon. Like that's fine, you're good.
Yeah, without having any kind of
assessment at all.
And that's really what it is with the C-section. Yeah, they don't even tell you to touch your scar. Yeah, even a little bit of self-mobilization. It's just same thing. Yeah, looks good, you're healed. You're like, am I okay?
I still feel super weird, and like where are my core muscles?
100%.
And, like, what am I doing? 100%. And what can I lift? But,
All right, you guys, so I think that was a good little introduction. Dr. Krystyna and I are planning on doing weekly little series about different topics. So we have some topics that we'd like to talk about, not 100% pelvic floor PT, chiropractic related, but could definitely probably tie in some way. But so every week we'll come to you guys live, talk about these different topics that are just about for moms in general, prenatally, postpartum, preconception, just different things to kind of work through. But if you guys have a topic that you would love for us to dive into a little bit more, or maybe even join us in discussion, if you're local, or we could even like Skype you in, that works too. That'd be awesome if you have some love of the pelvic floor, the human body, the big mommy body, whatever.
And even if you're not a mom and you just want to know more about this section of your body that we like historically don't talk about, we'd love to answer questions about any of that. Definitely see people who aren't moms.
Yes.
Maybe they're intending to become a mom at some point, maybe not.
Right.
I think a common misconception is that it's only people who are postpartum who leak when they laugh, jump, cough, or sneeze. Only people postpartum who have pain with sex, and like neither of those things are true. So
right, 100%. So yeah, we can dive into any topic that you guys might want to hear about. How do they get a hold of you if they want to schedule with you?
Yeah, so www.inclusivecarellc.com is my website.
I'll put that in my comments. Obviously, we're coming live on Dr. Krystyna's page too, so you can find her through there, but I'll definitely put that in my comments too. And then that'll have contact information, everything like that. Running any new patient specials or anything?
Yes. So free consultations, just if you have more questions about pelvic floor physical therapy and what it is and whether or not it would be appropriate for you, if I think it would help you, I would love to chat with you about that, either on the phone or in person.
Yeah. You do video chat and stuff too, right? So you don't have to be 100% local. Obviously, she can't feel anything through the computer, but she'll probably find somebody that could.
Yes. And if you're not here in Denver or in the Lakewood area, and you want just more information or a resource, like I love connecting people to pelvic floor physical therapists in their city. So please reach out to me with that information. I'm Krystyna.Holland on Instagram too, and that's a really good way to reach me as well.
Right, perfect. Yeah, so if you guys want to schedule with Dr. Krystyna, talk all things PT or pelvic floor, whatever you want to talk about, right? Well, okay, let's keep it to that, right? You can always contact her, right? On her page. If for whatever reason you can't find her, obviously you can always connect with me on my page and I will directly connect you. If you guys have any other questions or anything, like I said, leave it in the comments. Share this with anybody that you think might need some PT love in their life. But yeah, that's probably about it, huh? Yeah. All right, we'll talk with you guys next week. Have a great rest of the week. Bye. I know.